All right, welcome everyone to the Sahlgrenska Global Health Hackathon. Today is going to be all about challenge number 4, infection prevention and control. I am Michele Erba. I run Event Tornado and also Pristine agency. We are supporting Jamie and Cecilia for the Sahlgrenska Global Health Hackathon. So today after my short welcome, there will be Jamie coming up on stage telling us more about the hackathon. And then we will have Emma Wright, Chief Medical Officer at Mölnlycke Healthcare, to talk about the challenge number 4, infection prevention and control, before we wrap it up at the end. Okay, now, Jamie, welcome, Jamie. How are you doing?
Yeah, Michele, I'm doing good, thank you. It's good to be here again.
Nice to have you.
Thanks. Yeah, but can we move to the next slide very quickly so you don't need to look at my picture? That's much better pictures on this slide. So great. No, but thanks, Michele. And I just want to give a very brief overview of the Sahlgrenska Global Health Hackathon and invite you all to sign up and show up with your interest, your ideas, and your insights. So the Sahlgrenska Global Health Hackathon is an event where people are coming together to collaborate to solve a problem or identify new opportunities, and this time it's in health and healthcare. Anyone can join, so whatever your background, students, clinicians, researchers, IT people, life scientists, everybody's welcome. We're looking to have that bring different people with different backgrounds together and let the magic happen. We will be focusing on 5 global health challenges, but we'll get to them in a minute. We'll also be taking this Global Health Hackathon to 6 countries around the world, starting in Sweden on the 1st and 2nd of February. And we're going to Spain, the US, UK, Germany, and Singapore. So we're very excited about this global tour, and we'll actually be ending up where we invite the best ideas from the different locations to join us in Gothenburg for a grand final at the NLS Days Life Science Conference in October. So that's exciting, something to look forward to. So more about the hackathon, the Sahlgrenska Global Health Hackathon. It's a series of on-site weekend innovation hackathons. We need fresh new ideas to tackle some of the most urgent challenges of our time. And as I said before, anyone can join who wants to help tackle key global health challenges. And the main point around here that I think a lot about is that it should be fun. So bringing people together that you might not meet normally and having a good time, brainstorming ideas. There's no coding experience necessary. We just want people to show up, as I said, with ideas, insights, and interest, and let the magic happen. These are the 5 areas that we are addressing generally in the hackathon. So as you can see, health equality, fighting cancer, healthy aging, infection prevention and control, and smart, safe, and sustainable healthcare. So today we're zooming in on challenge number 4. It's infection prevention and control. It's all about how we can combat antimicrobial resistance and reduce healthcare associated infections. So these are 2 global health threats leading to widespread illness and death. We're very pleased to have Emma Wright, Executive Vice President and the Chief Medical Officer at Mölnlycke Healthcare, with us today, and she'll help us to dig into some of the details on this topic. Emma, over to you.
Hello, my name is Emma Wright and I'm the Chief Medical Officer for Mölnlycke Healthcare. I'm delighted to do this webinar today on infection prevention and control as part of the Sahlgrenska Health Hackathon. Infection prevention is something I've been involved with throughout my career, and it's a critical issue in healthcare today. When we talk about infection prevention, I'm really going to speak about healthcare acquired infections, and particularly hospital acquired infections. And these are things that you see in newspaper headlines all across the world, really impactful statements around patients who've gone into hospitals or other healthcare facilities for whatever reason, primarily to get better. And they've come out with something that's made them sick, something that they have acquired in the hospital in terms of an infection that then has consequences to them in terms of the impact of their life, but also has consequences to the healthcare system. It's something that requires further intervention, further cost, further resources are used. So hospital-acquired infections or healthcare-acquired infections in reality are a major issue in the healthcare systems across the world today. And it's not just in the emerging markets, they're also an issue in the developed markets where you'd expect us to have a good level of infection control in our healthcare settings. I want to first start about a story, a patient story. I think it's really important to talk about the patient impact of a hospital-acquired infection. Carol, a friend of mine, is actually a retired nurse. So someone who has a good knowledge of the healthcare system and a good knowledge of how to look after her own health. She's in her mid-60s. She was in good health. She was fit and active. And she recently underwent a foot surgery to address a chronic pain issue related to Morton's neuroma. This was done in a general hospital in the UK. It was meant to be a very straightforward procedure done in an outpatient setting. But when she went to her first follow-up visit after the surgery, she raised concerns about the wound that was left on her foot after the excision of the neuroma. But she was dismissed and told everything was totally normal. In her heart, she knew things were not normal. She was concerned about the wound. It didn't feel right for her. And sure enough, an abscess formed, as you can see in the image. And this was painful, but equally, it also prevented her from mobilizing. It had a major impact on her life. She couldn't get footwear. She couldn't be active. And ultimately, this inability contributed to a deep vein thrombosis, a major medical issue. This meant that she had to then go on to prolonged antibiotic treatment. She required blood thinners and frequent hospital visits. And this took a toll on her mental health as well because of the consequences of a hospital-acquired infection. It also then had subsequent increased costs to the healthcare system in managing that infection. So if we now move to some facts and figures, 1 in 10 patients who go into the hospital will develop a hospital-acquired infection. 25% of patients that go into a long-term acute healthcare facility will develop a hospital-acquired infection. 1 out of 3 patients who are in intensive care, our most high-risk patients, will develop a hospital-acquired infection while there. And most staggeringly, in the US, hospital-acquired infections kill over 100,000 patients per year. That is more patient deaths than result from prostate cancer and breast cancer put together. As I said before, it's not just about the consequences on the patient, even though that's the heart of the issue, but it's also the cost to our healthcare system. Again, looking at the US numbers, $35 billion is spent annually on managing hospital-acquired infections. These are things that are preventable, that shouldn't occur. Hospital-acquired infections increase the length of stay in the hospital for a patient by a staggering 17.6 days. And in the US government penalises hospitals for patients developing infections in their care settings. And they do this by penalising the reimbursement they get from Medicare. And that's at a level of 1%. So 1% of their Medicare reimbursement is used as a penalty because they had patients develop hospital-acquired infections. That may not seem much to you, 1%, but when your hospitals are operating at very small, if any, profit margin, the best hospital in the US is operating on a 4% profit margin. To lose 1% of your income, your vast majority of patients will be under the Medicare coverage, has a huge impact on your profitability as a hospital. So there is a famous quote, which I think is very relevant when you're talking about hospital-acquired infections. Benjamin Franklin famously said that an ounce of prevention is worth a pound of cure. And if we look at that in more detail, increased healthcare costs. Hospital-acquired infections extend hospital stays and treatment durations. They result in higher medical costs for both the patients and the healthcare systems, just as I just showed on the last slide for the US. But there's a wider impact, an impact on public health. Hospital-acquired infections can contribute to the spread of infectious diseases such as pneumonia within the community, and they pose a broader public health threat. HAIs compromise patient trust. Patients have entered the hospital to be treated, and yet they've left the hospital with a condition they didn't have when they arrived. The occurrence of HAIs can erode patient confidence in healthcare systems. It impacts their trust in medical professionals and the institutions. And just like my example of my friend Carol, she went to those follow-up visits, truly believing that her concerns about that wound and potential infection would be taken seriously, and they were not resulting in further consequences for her. The long-term health consequences are clear. Some HIs can lead to lasting health issues and disabilities affecting the patient's quality of life long after their initial treatment. The higher mortality risk. How shocking is that figure that more patients in the US die of hospital-acquired infections than of the two major cancers of prostate and breast put together? Infections acquired in the healthcare settings can lead to severe complications, including death, especially in vulnerable or immune-compromised patients. Let's talk about the causes of hospital-acquired infections. The first source has to be the patient themselves. That may sound a little strange, but we have an extensive skin flora on our skin. And imagine a patient going for a high-risk procedure, such as colorectal. You can imagine the amount of bacteria present in the intestinal tract. So the patient themselves can infect themselves. Even with proper hygiene and sterilisation, we can still find that in high-risk procedures, patients can get deep infections due to the type and nature of the surgery they've had. That's classed as direct infection. There's also direct infection from their caregivers. So again, regardless of proper hand hygiene, scrubbing going into surgery, as much as we try to create an aseptic environment, there are situations where the caregivers themselves, friends, family members, will pass on an infection to the patient. Then there's indirect infection. So for example, the devices that may be implanted in a patient, be that dental. Dental is a classic example of hospital-acquired infections, or it can be orthopedic implants. All of these devices in themselves can carry an infection. They can be coated in something called biofilm, and that's where bacteria will sit quite dormant in a gelatinous-like material covering these devices. But much later after the surgery, even up to 10, 15 years later, these bacteria can become activated and lead to a hospital-acquired infection. So hospital-acquired infection is not something that is immediate post-surgery. There's also the hospital facilities themselves. Many patients are in hospital. Many of them are sick. Many of them are carrying very different bacteria and viruses, and then themselves can get onto any of the environmental facilities around them and consequently infect the patient. And this is when we talk about indirect infection. But regardless of whether it's direct or indirect, equally, we can end up with patients with hospital-acquired infections. Clearly, hospital-acquired infections are highly concerning for the patient, for the healthcare provider, and for the healthcare system. But the good news is that about 50% of these infections are actually preventable. And we each have a role to play in that. The patient themselves, maintaining proper hand hygiene, using antibiotics according to the instructions, completing the full course of the antibiotics. We need to provide information to patients, to the clinicians, and to their relatives to ensure that they maximise their opportunities to prevent infection prevention. We then have the healthcare staff. Again, proper hand hygiene, the appropriate number of specialised infection control staff who can educate the wider group on the need to prevent infections. Training and education is key. and then early and prompt removal of invasive devices that may have become infective or be carrying a biofilm that needs to be treated. We can also do things by risk assessing both the patient, the surgical procedure, and any implants they're going to have to try and in advance determine their risk of infection prevention. If we can determine their risk in advance, we can be proactive in managing that prevention risk through technology and different approaches to managing the wounds post-surgery. Then we have the hospital administration. A major thing is the antimicrobial stewardship program to ensure that we appropriately use antibiotics. Today we have an issue of antimicrobial resistance. Overuse of antibiotics has led to some patients with some bacteria not responding to those antibiotics. This makes the infections very difficult to treat. So we need to be ensure that we're using antibiotics appropriately in the right patient at the right time. We need to monitor the hospital-acquired infections so we have data to truly understand how many infections are occurring and be able to track to some of the predominant sources of those infections. We need to screen in advance patients who may be carrying infection, particularly of multi-resistant microorganisms such as MRSA. We also need to screen the healthcare professionals to see if they're a carrier of these multi-resistant microorganisms. And again, risk assessment. Who's at greatest risk of bringing an infection into the hospital and why? The hospital environment itself. Isolation capacity, so patients who are infected can be put into single rooms. The appropriate cleaning routines of the building, but also the design of the building, looking at how air flows through the building to minimise again the risk of infection. The availability of hand rub dispensers at the bedside and in examination rooms. So my final message, let's free patients from the burden of hospital-acquired infections through innovation and collaboration. Through embracing partnership, we can tackle this preventable killer. Thank you very much.
Thanks so much, Emma, for the really insightful video. So hopefully it's given you some food for thought as to how you might want to tackle infection prevention and control in this hackathon. Okay, but now Michele, so maybe I could ask you, we're going to wrap this up. Maybe you could let people know how people can find out more information about the hackathon.
Absolutely. Thank you so much, Jamie. So under the description of this video, you will find the link to our webpage of the hackathon, our LinkedIn page, and our Instagram account. So please follow us in there to have more information about this. And of course, if you want to directly register for the hackathon, it's super simple. You go to eventtornado.com/events. You find your local hackathon you want to participate in, you click on it, and you click on register. That's very simple, and that's it. So yeah, happy to have you on the hackathon. Maybe, Jamie, we can say some words about our amazing partners.
Yes, and you're one of those, Michele. So with the Pristine agency and the Event Tornado platform. So thank you so much. These are the logos of our amazing partners. As you can see, they're big global partners and they're local organizing hosts. So it's been amazing working with this project. There's so many people involved and so much positive energy. Big companies, AstraZeneca and Microsoft, Afri and Mölnlycke, who you've heard from today. So we're very, very excited about this and want to thank all of them. Want to thank Emma for delivering the video for today's information session. And we hope you'll be inspired and informed to want to join the Sahlgrenska Global Health Hackathon. Thanks so much. And hope to see you soon. Bye-bye.
Thank you, guys. Bye-bye.